Assalamualaikum warahmatullahi wabarakatuh. My name is Azrin Dilaila binti Ahmad. Introduction. Policy is a deliberate system of principle to guide decision in order to achieve goals as well as deliver rational outcome. This research discusses on the National Strategic Plan for the Non-Communicable Disease (NSP-NCD), where this research would like to study the Malaysian Ministry of Health in improving the health status of Malaysians through the policy formulas, especially efficiently and effectiveness of policy reformation, as well as deepen the program provided by the various health agencies. There are 9 programs under this policy, and there are 2 programs that has been chosen for this research, which are National Strategic Plan for Tobacco Control 2015-2020 and National Plan of Action for Nutrition of Malaysian NSP-NCD 2016-2025.
National Strategic Plan for Tobacco Control is being implemented by the Ministry of Health in National Strategic Plan for Non-Communicable Disease in 2015 to curb with the smoking problem among adolescents and adults in Malaysia, as well as in line with the country commitment to the FCTC agreement since 2005 and towards the NCD global target by 2025, along with the end game to drop 30% in smoking. There are 4 main strategies in this plan. The reformation is contained under the threatening tobacco control activities through the Empower strategy, which is under P and O. Reformation under P strategy, which is protect people from exposure to second-hand tobacco smoke, Article 8. The reformation is made by extending the smoking ban from the rest area and treat site on stop on the highway on 2015 to all hotels by 2016, all rest park and public parks on 2017, all restaurants and not air-conditioned by 2018, any public area closed by 2019, and any public areas open by 2020. Next reformation is under words O, which offer help to quit tobacco use, Article 14. The reformation can be seen in 2017. The government has decided 30% of the secondary school with the counselling program. Then in 2018, another 50% is determined by the secondary school government with the counselling program.
The Malaysian National Plan of Action for Nutrition is a 10-year plan that uses trans and multi-sectoral approaches to solve food and nutrition concerns in the country. The plan emphasizes the role of nutrition in improving population health and preventing diet-related disease. Ministry of Health of Malaysia has done some initiative by conducting strategies and activities under the plan. However, based on NSP-NM2 and NSP-NM3, the activities has undergone some changes and reformation due to weaknesses that can be found from the previous ones, such as lack of indicators and evaluation criteria, a lack of clear target for each strategies, and many more. Some activities found that go through reformation are under facilitating strategies. National Plan of Action for Nutrition of Malaysia wanted citizens to have access to nutrition information. One of the activities in NSP-NM2 is intensive the publicity of healthy eating programs. These activities is a set of guidelines have been developed for public dissemination through a variety of media and approaches. This activity has undergone reformation in the NSP-NM3, where Ministry of Health has developed My Nutri Diary apps in order to reach and approach more consumers through digital technology. This app has produced a good result, almost 40,000 downloaders through mobile by the year 2020 and 5,000 downloaders annually. Next, under Enabling Strategy, NSP-NM, Ministry of Health wanted to improve household food security, especially among the low-income group. One of the activities in the NSP-NM2 are involving school children, where they wanted to ensure that students have access to food that is both affordable and nutritious by ban on school sales of non-nutritious and unhygienic foods outside school premise. This activity has been carried out from the year 2006 until 2015 by the school has participated by hanging no hawking signs posted on their premises. However, this activity has gone reformation in NSP-NM3, where Ministry of Health focused this activity more to promote healthy eating among school children by enforcement of the prohibition on selling unhealthy foods or beverages to children within 40 meters of the school perimeter. This will help to prevent students from buying unhealthy foods and reduce the risk of obesity among students.
Assalamualaikum. My name is Siti Ashaminta Rosnan and I will explain about challenges in implementing the National Strategic Plan for Tobacco Control 2015 until 2020. First, economics. Dr. Nur Hisham suggested that the increase in tobacco tax will reduce the amount of smoking consumption. However, the number of cigarette smuggling remains the same. Therefore, government needs to spend a large amount of money to provide health assistance to smokers. Second, social. All citizens are aware of the dangers of smoking tobacco to health. However, a small number of citizens still do not care about the information provided by the health authorities. Therefore, government needs to disseminate information related to effects of tobacco use more effectively. Third, politics. The support from government is not in line with hopes of reducing the disease associated with tobacco cigarette consumption. Information advertisement related to tobacco cigarettes are less aired on television or on media social. Therefore, government should broadcast information advertisement related to tobacco cigarettes more often. Constraint in implementing National Strategic Plan for Tobacco Control 2015 until 2020. Lack of awareness and education in promoting more attractive health programs. There are several comprehensive tobacco control programs that have been implemented since 1993. However, the younger generation is less interested in information related to health programs. Therefore, the government needs to generate ideas to produce programs that can attract the younger generation.
Next, the challenges in implementing these policies. It can be identified in three aspects, which are political, economic, and social. First, political aspect. The support from government is not reached the expectation. There is minimal advertisement regarding nutrition advertised on television. Second, academic aspect. Government does not impose tax on processed food and junk food. This action is vital to ensure the society in Malaysia can minimize the consumption of unhealthy food. Third, social aspect. Nutritionists and health workers face difficulties of misleading and fake news regarding food and nutrition information on social media. Next, the constraint faced by the authority. First, workforce shortage. There are minimal number of nutritionists in healthcare sector. Government should take an initiative to cater this problem to ensure all the generations in Malaysia get the sufficient nutrition in their body. Second, lack of enforcement from government. Most of people tend to sell unauthorized supplement of health. This could drive to negative impact to the buyer like kidney failure. Hence, government should enforce restriction in controlling people who sell the supplement in wrongful manner.
National Strategic Plan for Non-Communicable Disease (NSP-NCD) appear as response to concern on the crisis that need to be addressed. Tobacco and nutrition programs and activities were intensified and launched as a supporting mechanism on the policy's implementation. Although the policies were presented at the exact time, challenges and constraints add on higher burdens on NCD's implementation and information for better strategic engagement in Malaysia. In fact, NCDs aim to achieve desired goal by providing specific roadmap to reach target. In short, the emphasis of whole government and society approach is important, as health is not only the responsibilities of Ministry of Health, but everyone's responsibility.